I want to take just a moment to recognize our public health employees that have been working tirelessly for the last more than 2 months. We have more than 60 contact tracers. We have more than 13 individuals in our call center. These are the heart and soul of public health and our effort to ensure our residents are safe. And I just want to say thank you to their hard work and appreciate everything they've been doing. I'd like to just provide a quick update on our skilled nursing facilities. As we report out every week, Kingston Healthcare Center continues to struggle with some of the COVID-related impacts. As of May 27th, the state is reporting to Public Health that there are 54 healthcare workers that have tested positive. There's 80 residents that have tested positives. And now that there are 18 residents that have unfortunately died from COVID-19. We are a little frustrated as we are receiving conflicting information from the state and Kingston itself on the number of impacted individuals, but the numbers that I've just provided is what we are been most recently provided by the state. Also important to notice that staffing has been a concern at Kingston. As we've reported on previously, the state has mobilized a team down, a medical assistance team that was made up of more than 30 individuals that have helped prop up the staffing at this site. Last week, Kingston submitted a staffing plan to the state indicating that they would be able to meet ongoing staffing needs. The state has watched over the last few days and has concurred with Kingston's plan. And as of yesterday, they have removed the state-sponsored medical assistance team from the site. Valley Convalescent Hospital has also been an area of interest for us. The state has reported to the county as of May 27th also that there are 19 healthcare workers that have tested positive. There are 40 residents that have tested positive, and there are 4 residents that have died. That is new that the Valley Convalescent is reporting to the state. Staffing has also been a concern at Valley Convalescent. They have contracted with different employment agencies to try to assist during this period of time, and most importantly, Liberty Ambulance and Ridgecrest Hospital have agreed to help. They're actually sending paramedics and EMTs down to fill in the gaps in their staffing plans. So we appreciate the willingness of Liberty Ambulance to assist. And then finally, we have our skilled nursing facility testing program that we've initiated within the county. We have been sending 5 different staff members to different skilled nursing facilities to help them test their employees. And the intent is to provide early notification of any individual that may be positive so that we can take action to prevent other employees from becoming ill and, most importantly, from those residents from becoming ill. We've been to Valley Convalescent and tested there. We've been to the Rehabilitation Center of Bakersfield, Height Street Skilled Care, Brookdale, Golden Living Center. We've tested more than 450 employees. On the 29th, we will be at Valley Convalescent, and we've booked out through the entire month of June of locations that we will be going to. With that, I'll turn it back to Megan for an update on testing.
Thank you, Matt. So our next item is just to walk through where we stand with testing right now on the state-funded and county-funded sites. Currently, we have 10 sites that are open. The state-funded sites include the Kern County Fairgrounds. We do want to make a note that we've moved the location of the building. It used to be in Building 4 and is now in the Harvest Building. So if you had an existing appointment, you'll notice that you now need to go to Gate 40. The other 3 locations that are state-funded are the Mojave Veterans Hall, the Kern Public Health Building, and the 5th District drive-through. Another important note about that location, the last day of testing will be Wednesday, June 3rd. So if you're using that location, please note that their last day of testing is Wednesday, June 3rd. For the county-funded sites, All of them are open currently. We have the Oildale location at the Good Samaritan Hospital, West Side Healthcare District in Taft, the Delano location at Adventist Health Delano. The Kern River Valley location just opened in the last day or two, and that's at the Kern Valley Hospital. Ridgecrest Regional is open, and Tehachapi Adventist Health is open as well. I do want to clarify, every single one of those locations requires an appointment. Sometimes they're referred to as a walk-up location, and what that means is that they do not allow drive-through, so there may not be a drive-through location. That does not mean that you can walk up without an appointment. So if you'll visit kerncounty.com, right on the front page, there's a big COVID-19 testing button, and we'd encourage you to go there to get information about all of the testing sites. Now I'm going to turn it over to our Chief Administrative Officer, Ryan Alsop, for another update.
Thank you, Megan. Good morning, everybody. Today in Kern County, population 900,000 plus, 25,033 residents have been tested for COVID-19. 22,000, or nearly 90% of those tests, are negative. We're seeking the results on 947 of those tests, which is about 4% of the total number tested. And we've got 2,007 residents, or about 8% of those tested, who have tested positive. We have 39 people in the hospital today, and we have 37 deaths. Of the 2,007 residents who've tested positive for COVID-19, 1,932, or 96% of those residents, are either fully recovered or are recovering at home, treating their symptoms on their own. Today, 39 residents, or 2% of those who've tested positive, are receiving care in an area hospital. And again, 37, or 2% of those who've tested positive have unfortunately passed away. Over half those deaths, as Mr. Constantine has mentioned, and as I have mentioned in previous days, over half those deaths are attributed to several state-regulated skilled nursing facilities. With that, I wanted to just let people know and just be very clear that COVID-19 is here in our community. It is not going away. We're going to continue to see people test positive, particularly as we ramp up our testing capacity throughout the county. This is not a virus that's going to be eradicated next month or the month after. This is a virus that's going to be in our community for the months ahead, the many months ahead, very likely, based on all the models that we're looking at, all the data that we're seeing in all of our conversations with state public health officials and others. So it's very important that we all continue to be smart as we go about our lives, continue to heed guidelines that are put out, use good hygiene. Please continue to wash your hands. I'm touching this podium now. As soon as I leave, I'm going to wash my hands, and I'm going to make sure I'm not touching my face between here and the sink. If you're sick, stay home. Stay away from sick people. We are most concerned in this community about our elderly population. We're most concerned about the population in our community that has a pre-existing condition or a set of pre-existing conditions. You are the most vulnerable. You are the most at risk for having complications once infected and becoming positive with COVID-19. You are the folks that we are trying to keep out of our hospitals and to make sure you're safe. I also want to say that this exercise that we have been in has always been and remains really to be about maintaining hospital capacity, managing the spread of this virus in our community so that we are managing the availability of hospital beds, ICU beds, and overall hospital capacity to not just treat patients who may need to be hospitalized due to COVID, but also so that we can take care of people in our community who are in car accidents, who have heart attacks, who have other medical situations that require hospitalization and ICU care. That's what this is about. We need to continue to remember that as we go forward, and everything that you're doing is really focused on that. That is a key metric, the key metric for our community as we go forward. That's going to determine how quickly we reopen or whether or not we need to scale back going forward. It's all about our hospital capacity so that we don't overwhelm our medical system. Today we are good. But this is something that we need to keep in mind as we go forward. So thank you for continuing to support our overall efforts. Thank you, businesses who are reopening. Follow the guidelines. Do it safely. Folks, just use your head and be smart out there and use good practices going forward. I want to mention, make some comments about skilled nursing facilities. Matt had talked about them previously. These skilled nursing facilities, we're talking about them. They're important because they are hotspots. They are hotspots not just in Kern County, but they are hotspots throughout the state of California, and they have been for weeks and weeks. And these are congregate care facilities. We have a significant number of our positive tests in this community are attributed to these skilled nursing facilities. We have 23 deaths as of today out of the 37 total deaths. That's 62% of the total deaths in our community are attributed thus far to at least three skilled nursing facilities in Kern County, the state-regulated skilled nursing facilities in Kern County. We need to get a handle on this. Our public health department, our public health director, our public health officer, they're doing a great job. They're stepping in. They are assisting the state. Again, these are state-regulated facilities. The state oversees these facilities. We are doing everything we can at the local level to assist the state in containing, testing, doing everything we can to make sure that we're addressing those hot spots, which frankly are skewing numbers here locally. Folks, the people in these facilities are a representation of the vulnerable people among us. They're elderly. They, more likely than not, all of whom have pre-existing conditions. They are that population that are susceptible to great complication and death potentially if infected with this. This is why we're seeing these numbers in these facilities. And again, that's why we continue to talk about it, and we will continue to talk about it as we go forward. The governor's reopening plan, don't want to spend a whole lot of time on this, but again, last week, restaurants and retail establishments in Kern County were allowed to open wider, moving from curbside delivery only into having customers come into the restaurants, customers come into the retail establishments. They are to do that following guidelines that have been issued by the state. You can get those guidelines if you're a restaurateur or if you own a retail establishment at covid19.ca.gov. We have put those guidelines out. We have had industry calls with these groups. Everybody should be aware and reading through those guidelines and be aware of them. They need to be followed, and we are excited that businesses like those are able to take the next step. But again, please follow the guidelines, and if you're going to those establishments, please respect those guidelines and follow the rules and procedures that are outlined by those particular establishments. This week, the governor opened barbershops and hair salons in Kern County. Barbershops and hair salons can begin getting back to business. Not entirely, but they can begin taking steps to begin cutting hair and taking appointments. There are a set of guidelines for those businesses to follow that have been issued by the state. We had a call just yesterday or the day before with these businesses. We've made them all aware. We've walked through guidelines. We answered questions. Again, those guidelines for those businesses are at covid19.ca.gov. Also this week, lastly, under the reopening plan, the governor has issued guidance for churches and religious organizations and services to begin. There are a set of guidance points for that to happen that must be followed. In particular, there's one of the guidance points limits churches to no more than 100 people at a service. This, I know, some people were upset to hear that and wanted to have more, but that's the guidance. That is what's been provided. We were happy to see that the governor left a little bit of room to expand beyond that and to provide changes and modifications to those guidelines for churches that could likely be as soon as within the next 3 weeks. We will see, but churches have the ability to begin reopening beyond where they have been and to begin bringing back people under a set of guidelines, and they should be followed. And we thank all of the leaders in our religious community for following and taking heed to those guidelines as they begin to contemplate how they reopen. Our Back to Business effort in Kern County, being led by 2 of our supervisors, Maggard and Scrivener, where we're continuing to discuss how businesses get reopened. Those calls continue. They are robust. We're being rigorous in reaching out to everybody that we possibly can. The intent of those calls are to make sure there's a continuity of communication, planning, understanding of their place in the world under the governor's orders. Currently, what the governor may be doing in the coming days, how they should be prepared to respond to what the governor announces in the coming days. That seems to be working very well. We've gotten some good feedback. Those calls will continue, and we appreciate those industry sectors and businesses that have been participating in those calls with us for your time and attention and feedback and everything that you're contributing to getting Kern County back to work. Tuesday, we began issuing accepting applications for small business financial support here in Kern County. Small businesses that qualify can go on kerncounty.com. There's information there under a link called Kern Recovers. It's pretty obvious. You really can't miss it. It's right on the front page. If you click on that, there are instructions on how, if you are a small business, how you may qualify to receive financial assistance today. We ask you to go onto the website. If you haven't already, take a look, see if you're qualified. Let me preface this by saying that we are targeting those businesses in our community most severely impacted by the governor's order due to the response to COVID. Those are businesses that have been substantially curtailed. Restaurants are an example of that. Where they were limited just to takeout. Obviously, there's a list of businesses in our community that were on the non-essential list. So we're targeting those businesses right now. We're targeting businesses that have not been able to receive other federal financial assistance in the past. Please go on. There are a number of banks that we're working with here locally. They are taking customers, whether or not you are a customer of theirs. It doesn't matter which bank you go to, they will process your forgivable loan. All the information's on our website, and I encourage you to go seek that out. Finally, county facilities and services, we're getting some questions. Listen, the county is in transition in reopening. Many county functions, many county buildings, facilities have begun to reopen. We have begun to bring some employees back. We continue to have some employees continuing to work from home. That is working well. We are going to be bringing the county back online again through a transition period. It's going to be based on our ability to keep not only our employees safe and as well as the public safe. So there are protocols, practices, planning that goes into that. We are working across the county to make sure all of that gets done. We're pleased with where we are. We're going to be updating our website daily on which county functions are back open. Monday, the County Administrative Center, the building that I'm in at 1115 Truxton Avenue, will be open. we will begin to reopen our building. We will begin to bring more employees back into our building. We've already begun doing that with our employees. The public may begin to access our building as soon as Monday. What we're asking the public to do is please don't come unless you have critical business or real good reason to be here. We ask you to take advantage of the telephone, email, the internet, to get as much business as you can get done that way. We ask that if you do need to come and have a meeting or need to get some service here in our building, that you call ahead and make an appointment. That would be ideal. It would allow our staff to pick a time and just better manage the flow of folks into this building. There will be a set of protocols and practices that you will have to adhere to upon entering the building. They will be enforced before you enter the building. That's going to be for all of our employees and all of our visitors coming in. But wanted to let you know this building will be back open. What will not be back open next week is the Board of Supervisors meeting. We have a Board of Supervisors meeting scheduled for Tuesday. We've got a fairly big room here in front of me. We've got about 60 seats that are open with the distancing. We just felt like this particular meeting, it was too soon to deal with bringing 60 people potentially back into a room, in one room together, the queuing, the managing of all of that. So we feel like we've got very good processes in place right now for folks to engage with the board at these meetings on any particular item, whether it's live, via email, or through voicemail. We're going to continue that on Tuesday while we contemplate how we open the board meeting as soon as the very next meeting that we have, which is in mid-June. So we're working plans on that currently. With that, thank you today for your time, and I'll hand it back to Megan.
Okay, so we're going to begin taking questions as usual. We're going to go down the list for our media partners that was given to you earlier today. We ask that you do not unmute your line until you're called upon to eliminate extra background noise. So I'm going to start with KUZZ. Do we have anyone on the line?
Yeah, hi Megan. Rob King from KUZZ.
Hi Rob, how are you?
Good, how you doing?
Doing well, thanks.
Governor Newsom recently said that we're not close to being done with this, and yet a lot of places seem to be having more places reopening than not reopening. So I was wondering if there's a current timeline to getting into phase 3 and kind of finishing quarantine and the stay-at-home orders.
I'm going to have Ryan take that one.
Hi, we don't know. There's been no timeline given for stage 3, although the governor has hinted that they would like to get to stage 3 as soon as possible. You know, while the governor has talked about this being, COVID being here in our state for some time, he has provided a pathway. His own administration has provided a pathway for counties under certain parameters to begin reopening at an accelerated rate under stage 2. He's provided guidance for churches, barbershops, salons, restaurants, retail establishments, and others. So his administration is putting out roadmaps and pathways for these businesses and clearance for these businesses to begin reopening under those guidelines. So his own administration is calling the shots on how we do this. They are allowing these businesses to get open. When we move into stage 3, just to be frank, we really don't know. We don't know, and we'll be paying attention and talking to the governor, and I'm sure that information on potential movement into stage 3 will be forthcoming.
Okay, and is that something that would require a separate variance attestation, like a phase 3 attestation?
We know not under what we currently know, but who knows? Who knows? The state could certainly do that. And I think that everything's kind of evolving. I think the county attestation, the numbers, the trigger points, the criteria probably will continue to evolve as we learn more and ramp up testing and look at numbers. And I think all of that is a big question mark, and it's going to depend on really what the state ultimately is going to want to do, but it's going to require some rigorous work on our part, communicating with the state, making sure that they have an understanding of the situation here in Kern, what our numbers are, what our readiness is, and we're going to maintain that posture with the state, that level of communication as we go forward in the weeks ahead.
Okay, thank you.
Thank you, Rob. Our next outlet is the Bakersfield Californian. Do we have anyone on the line?
Hello?
Yep. Is that Sam?
Can you hear me?
We sure can.
Yeah. Okay, cool. My question is that given that more and more businesses are being allowed to open and churches are being allowed to open, I was wondering if the county models show or are predicting that there will be a rise in positive cases. And I know that we were at an average of 30 positive cases per day a week or two ago, and I was wondering, are we still at that level, and do we expect it to increase now that social distancing is going to decline?
Okay, Sam, we're going to have Matt Constantine answer your question. Just give us 1 second.
Okay, thank you.
Morning, Sam. So to answer your last question first, the average that we are looking at now is about 43 cases per day as we average that out. And you're right, as more businesses are allowed to reopen, but it's important to notice under those guidelines where there are restrictions and PPE requirements and limitations that address these risks, and our hope is that everybody's following those carefully. But we are going to watch the numbers. The modeling has not changed much. The ability for more businesses to open up has only been something that's recently been allowed. You know, as you're aware, there's about a 2-week incubation period for COVID-19, and then there's a little bit of delay on reporting. So we're going to watch those numbers over the next 3-week period. You'll notice the governor put in a 3-week period to watch for churches, and that's for that same similar reason. So we want to track that carefully and see if it changes, but it's really too early to know now.
Okay, thank you.
Thanks, Sam. Our next outlet is Kern Radio. Do we have anyone on the line?
Good morning. Excuse me. Good morning. This is Ralph Bailey.
Good morning, Ralph. How are you?
I am good. How are you?
Doing well.
With the history of problems at nursing facilities all over the world, Sweden, Washington State, all over our state, all over Kern County, how are the staffers still getting infected? Are they not properly equipped with PPE? Are they just being careless? Because it would seem if any staffer would be extremely careful, it'd be folks working at these facilities.
Matt, do you want to respond to that?
Sure.
Thanks.
Morning, Ralph. So you're right. As Ryan has said, skilled nursing facilities needs to be one of our highest priority site as a state and county government. These are state-regulated facilities. The county has no authority. The county doesn't go into these sites. The state has their complete authority over these sites. But based on the numbers that we're seeing and the limited duration that we have been in there, we're concerned. We're concerned that there was not enough PPE available to the employees, that they were not following the procedures correctly, that there was a lack of procedure. Their infection disease control methods was not adequate. That can clearly be demonstrated by the numbers. So we have asked the state to do more. We're on routine calls with them. We've ourselves pulled the skilled nursing facilities together on the phone to say we need more, we need better. We've reported out that FEMA is actually delivering PPE now directly to our skilled nursing facilities. But you're right, this remains a concern to us. This is our most vulnerable population. This is nothing that's new. We've watched it not only through this pandemic, but other respiratory illnesses and other diseases, how skilled nursing facilities are affected. So this is nothing new, and more needs to be done to protect our most vulnerable.
Thank you.
Hey, Ralph, I just wanted to address, make a couple of comments on SNFs too. I can't help myself. This is a problem. The SNF problem is not a problem for Kern County because it's skewing our numbers. It's skewing our total death numbers. It's a significant percentage of our total positive rate. It's a problem because we've had 23 individuals to date, Kern County residents, loved ones of Kern County residents who have been placed in these homes who have died. We have a number of them that are hospitalized. We have a number of healthcare workers in these facilities who have been exposed. And that is really the egregiousness of the situation with SNFs here. We are wrapping all of the resources and personnel and time that the county has around these facilities to the best of our ability. We're assisting the state. These are state-regulated facilities. I would have liked to have seen the state, if I may say so, and I don't want to be antagonistic here, but in the early days of this pandemic, in the early days, I would have liked to have seen the state knowing that these SNFs have been hot spots in other areas. We had a situation in Washington and in other states where we were shown that these were potential hot spots, that COVID, once in these facilities, spreads rapidly, lots of death, lots of positive cases, lots of hospitalizations. I would have liked to have seen the state of California deploy more resources, put an army of people out throughout the state in the earlier days of this pandemic, put a general pattern into each one of these facilities throughout the state to make sure that these facilities were doing the appropriate distancing and putting the appropriate protocols in place to keep these patients safe, that they had the appropriate PPE, that they had the appropriate hygiene controls and monitoring, and that testing was being done. That should have been done in the early days of this pandemic, and I'm frustrated by that.
Thank you, Ralph. Our next media outlet is Channel 23. Do we have anyone on the line?
Yes.
Go ahead.
Hi. How's it going?
It's going well, thank you. How are you?
I'm good. All right, so just a few clarifications. So of the 7 people that were announced that have died yesterday, how many of those people were from skilled nursing facilities?
Give us 1 second.
Hi, because we don't have a good answer for that right now, I could say it might have been a number. I'm not going to do that. I'm just going to tell you that to date, 23 of the total 37 deaths in our community are from several different area state-regulated skilled nursing facilities.
Okay, is the reason we don't have that number?
I think we just don't have it at our fingertips right now, Tori. I'm sure someone can get back to you later, though.
Okay, awesome. And then, have you guys had any issues with businesses that have been trying to reopen? Have you guys been receiving any complaints with people not following the rules and guidelines that are in place that have been spelled out by the state?
We'll have Ryan answer that.
Yeah, I mean, to just be honest with you, yeah, a few. There's a learning curve here. Businesses are going from zero to in some cases, zero to getting open back up. They're having to walk through and abide by a set of, operate under a set of guidelines that are a range of different things, from planning to practicing to hand washing to distancing. There's a variety of things that these different businesses, they're different for every business, that they have to do. And I think there is a bit of a learning curve, and we stand ready as a county, our public health team, again, to engage with those businesses as we have been for the past many weeks, to reinforce the information that is coming down from the state, the directives, the guidelines, to work with them to ensure that they have the full understanding of what it is they need to be doing and how to operate. A good example of this communication is, these industry calls that we're having. We were on the phone yesterday or the day before, I can't remember, all the days are running together for me, with restaurants, many restaurants of different sizes and scope from across the county, where we're walking through with them these guidelines, answering questions with our public health team. So we're in chambers, we're working with chambers so that their members can call them to ask about these guidelines. We believe we're in a good place, and where businesses are outside those guidelines, we will continue to maintain our posture of working with them and to ensure that they have a full understanding of the governor's directives.
All right. And I only have one more question, and then we can keep it moving. Unless that's not a problem. If that's not okay, it's fine. The only other question I had was, obviously, I've been covering this story, and I've been assigned the Kingston facility a few times, and I can speak from experience that, according to Kingston, the state has said that they have correct infection control guidelines in place. So given the fact that, actions speak louder than words, and obviously we all know this is something you guys are trying to get under control, have you guys posed the question to the state to maybe have people reevaluate their infection control guidelines and whether or not they're being followed, considering that was what they said and this is where we're at now? Because you guys just said people left, right? Just like a group of people left.
Oh, I didn't get your last comment. A group of people left? Is that what you said?
Is that I felt that was
the county team. Yeah, the county team. Yeah, I think, Tori, the only way to answer your question is to simply say that SNFs, in this case you mentioned Kingston, Kingston's track record is not good. Anybody can go online and read about it. You've reported on it. It's not good.
Yeah.
I would only tell you that they account for a significant number of positive cases, both with staff and patients. And today, as of today, they account for 18 deaths. 18 deaths in our community. So that it is what it is. And if you ask me, I'm not a public health person or a doctor, and I don't have a lot of engagement. I don't have anybody that in my family that is currently in a skilled nursing facility. But if you ask me, there's lots of room for improvement, and I'm looking forward to having a conversation with our own medical leaders in this community, with our public health director, making sure that we have a conversation. Not that we're not having conversations, but we've got to figure out some way to ensure that the residents in these facilities who are regulated by the state are taken care of, and that there are better measures in place. There are more touches on these facilities by the state. There's better oversight, and there's quicker action taken, and certainly quicker action in a situation like this, in this pandemic, where we knew that these were hot spots. There should have been, again, resources deployed immediately into these areas, and I hope that answers your question.
Yeah, it was just kind of something I was wondering if you guys were concerned. But all right, thanks. That's all I had.
Our next outlet is Kern Soul. Do we have anyone on the line?
Hi, Megan. This is Elizabeth from Kern News. How are you?
I'm doing well. How are you, Elizabeth?
Good. My question is about just some of the numbers on the dashboard. I was curious, two questions about those numbers. One is about the hospitalization rate. So when I look at the number of hospitalizations on one day, so say I looked at it on May 26th, and it said there were 44 hospitalizations that day. And then today, when I went back and looked at May 26th again, it said that there were 38 hospitalizations that day. So I'm just looking for an explanation why those numbers are fluctuating. And then my other question is about Kingston. The state is reporting 28 deaths at that facility. So I'm just looking for clarification on the number of deaths there as well.
Elizabeth, we're going to have Kim Hernandez, our lead epidemiologist, answer that. Give us just 1 second to get her up.
Thank you.
Thanks for your question. We know with our dashboard, we are constantly trying to update it to the most current information. Some of this has to do with the lag in information that we receive. Some of this is patients who may be hospitalized outside of our counties. So when we find out about them, we are making sure that those dates get entered into the correct date on the dashboard. So we know that there is some confusion, particularly with recent data in the last 5 or so days. We do know that we often have to update those dates on all of our information because this information is flowing at any point in time. Obviously, we try to get that information up to the website by 10 a.m., but of course, whatever happens today over the course of today won't get updated, but there will be differences in today's information tomorrow, because over the course of today we will have people who are released from the hospital who become hospitalized during the date, and so there are some of those changes. We know that everybody has struggled to keep track of those things. Every day the dashboard is made as current with the best information that we have, and so that does affect sometimes previous days. Thank you.
And Elizabeth, I'll try to address your Kingston question. And this is frustrating for us, and I'm grateful that you're bringing this up. You are correct. On the state website, they are reporting 28 deaths that have occurred from Kingston. The state informs us that this number is provided by Kingston. They update the information and get it to the state, and the state reports on it. When we saw that yesterday, we called the state. We don't have an answer. We assume they made a mistake, and instead of putting 28, it should have been 18. But just to show you how confusing this is, Kingston did call yesterday, and they indicated there were 15 deaths. And then the state yesterday sent us a report that there were 10 deaths. These are people. These aren't numbers. And it's important for us to recognize that it is the obligation of Kingston to not only care for our most vulnerable population, but also to give us accurate data. The most accurate data we believe we have is 18 residents that have died. But this only gives an early indication of some of the systemic issues that we're having with something as fundamental as data. So 18 is the number that we believe is correct and that has been reported to us by the state. Thank you.
Thank you, Matt. And thank you, Kim.
Okay, our next outlet is the Mojave Desert News. Do we have anyone on the line? Okay, we'll go to the next outlet, Channel 29. Do we have anyone on the line?
Hi, it's Fiona with Channel 29. I just wanted to clarify, are we still sitting at 1 death at Orchards Post nursing home?
Yes, we are.
Okay, great. I have another question too then about enforcing face masks. So this week the CDC said that over a third of people who have COVID-19 are asymptomatic. So has that changed the county's game plan of enforcing face masks in businesses and other public places, or are there any plans to get county leaders together to potentially come up with more guidelines on this?
Fiona, I'm going to ask you, it sounds like your microphone may be a little bit muffled. Can you start the beginning of that question one more time?
Sure. So earlier in the week, the CDC said over a third of people who have COVID-19 are asymptomatic. Has this statement changed the county's game plan of enforcing face masks in businesses and other places?
Okay, thank you. I'm going to have Matt answer your question.
Thank you. So on face coverings or face masks, the recommendation is to wear them. Face coverings have been proven to help limit the transmission of COVID-19. And really, as somebody wears a face covering, that is protecting others from potentially getting infected from you. So if everybody's wearing a face covering, that should help significantly. The CDC and CDPH recommends the wearing of face coverings, especially when we can't maintain that 6-foot separation. I know the state has been exploring the idea about recommending it statewide, regardless of distancing, and I know some other counties have taken other action. We are going to go by what the CDC and CDPH says is the best science to protect our residents. So I know it's an item of discussion. We would encourage everybody to wear face coverings when they can, because, again, it protects you and it protects others. Thanks.
Okay, our next outlet is Channel 17. Do we have anyone on the line?
Hey, Matt, Ryan, and Megan, it's Eitan. How are you doing?
Doing well. How are you, Eitan?
Good. Thanks so much. You know what? And I sincerely apologize if this was asked already. I know that Ryan understandably says please do not ask repetitive questions. It was a little bit tough for me to hear the other questions. So if it was asked, just tell me it was asked, and I'll move on. Of the 7 deaths yesterday reported, how many of those came from skilled nursing facilities and specifically Kingston?
So it looks like we've been able, since Tori asked the question earlier, we've been able to find the number. At least it's being flashed up around me. So we believe the number is 4.
My bad.
No, that's okay. We believe the number is 4. We actually didn't have the answer a minute ago. So thank you for asking again.
Oh, thank you. So number is 4 just of skilled nursing facilities in general or specifically for Kingston, Megan?
That I don't know. It's 4 for skilled nursing facilities.
4 for skilled nursing facilities. Okay. Thank you. So my only other question for you is regarding the loan applications and the loan program that the county is implementing. How is that going so far? How many applications have you received? I know Ryan was saying seems people are pretty optimistic about that. Businesses are optimistic. How's that going?
Yeah, thanks for the question. It's going well. The financial institutions that we're partnering with are very, very busy. They got very, very busy on Tuesday. We know that applications are being filed, applications are being reviewed, and at this time, I'm happy to say that these forgivable loans are being issued. There are businesses today that are being written checks or having money wired into bank accounts today. So we're pleased with where we are. We'll see how it goes over the next 2 to 3 weeks and continue to provide updates to you.
Thanks, Ryan.
Thank you, Eitan. Our last outlet is KNZR. Do we have anyone on the line?
ZR, can you hear me okay?
We can.
Hello? Okay. I'm curious about the entertainment part of opening businesses. There are many restaurants that provide karaoke, which I think is an interesting thing because there you have a microphone or 2 microphones and a lot of people using the same one. So even with social distancing, I'm just wondering, have you given any thought to when that type of entertainment will be allowed again? Because a lot of folks are calling and asking me here. And also there are jobs associated with that as well. So what are your thoughts about that?
Well, my thoughts are I wish we could put a mask in normal situations during karaoke for most people. Certainly me. But no, the governor's not provided any guidance on that, sir. We just don't have direction. It's not part of the directives that have been provided by the state for restaurants, bars, where I think karaoke typically happens because obviously you have to consume a lot of alcohol before you get up on a mic in front of a lot of people. But their bars aren't open, and they're part of stage 3. Restaurants, no guidance on that yet, and we're going to be again staying in touch with the bar industry, the restaurant industry, and those venues on things like this, and certainly in touch with the governor's office on things like this as we go forward. That was a great question. There are lots of kind of in-between things that are important. Obviously, one of those is nail salons, right? So hair salons, beauty salons are open. You can go in, make an appointment, have your hair done. If you're a man or a woman, whoever you are, if you want to have your nails taken care of, that's not allowed. That's not allowed, and that's a big part of, you could argue, a big part of that particular industry. Certainly for businesses, nail salons aren't addressed in the guidelines, are not allowed to open. Again, if you're a hair salon opening, you're not allowed to do nails still. So that's an example. I think that's similar to karaoke. We're going to be continuing to talk with the governor, interfacing with his public health team, and talking through these things, and hopefully we see some evolution in these guidelines in the days and weeks ahead, because I could make an argument that you could do both those things, both karaoke and nail, the nail business, with protocols in place, masks, washing hands, separation, etc. So thank you for the question.
Thank you.
Okay, that concludes our briefing for today. We want to thank you all for joining. We will be back again next week. If you have any questions in the meantime, you can always reach out to myself, and we will we'll work to get those to you as quickly as possible. Thank you.
And you've been watching the latest update from Kern County Public Health and county government officials on the COVID-19 crisis here in Kern County. A lot of talk, of course, about the reopening stages happening right now here in Kern County and across California as we see more businesses and more sectors begin to move forward with phase 2. The latest numbers, there was one new death reported this morning, bringing our total here in Kern County to 37 who have died from COVID-19, and there were 66 new cases diagnosed as of today. The big takeaway on the numbers of deaths right now is that of the 37 here in Kern County, 23 are from local nursing facilities, 18 just at one nursing facility alone. That's Kingston Healthcare, which we have reported extensively on. You can find those reports at kget.com. Another just little recap of the numbers here. 25,000 people have been tested here in Kern County. There are 947 tests still pending, and there are 39 people currently in the hospital right now battling COVID-19. Again, that hospitalization number is really key as county officials watch that and use that number to prove to the state that Kern County is ready to push forward with reopening different sectors of our economy. We will have a full recap of today's news conference and everything you need to know coming up today on 17 News at noon and 5 and 6. For now, have a great Thursday, everyone.